my name is Brodi Stevens, and I attend Central High School in Phoenix, Arizona as a rising senior, and this is my second year with the Summer Institute on Medical Ignorance. This summer, I had the privilege to work in Dr. Gertner's lab, and in our lab, we focus on skin regeneration and wound healing research. My lab's main research question is, what are the molecular mechanisms behind wound healing, and how can we treat wound healing? The Gertner lab wants to answer our main question of, what are the molecular mechanisms behind wound healing, and how can we treat wound healing? Because the cellular or molecular mechanisms underpinning tissue repair and its failure to heal are still poorly understood, and current therapies are limited. To try to find an answer to this question, my lab has conducted many different experiments that focus on different aspects to this issue. Pertaining to my project specifically, my experiments are trying to answer the question, how does a particular disease like diabetes interact with the tissue healing process? Some research and experiments my lab conducts to try to answer our main questions involves producing a quantitative and reproducible murine model of excisional wound healing. Since there is currently no model of wound healing in rodents that closely parallels human wound healing, our lab is investigating a novel model of wound healing in mice utilizing wound splinting that is accurate, reproducible, minimizes wound contraction, and allows wound healing to occur through the process of granulation and reepithelialization. Getting into the work I do within my lab to contribute to our research, I spend a majority of the days conducting my surgeries to create these models. To very briefly outline the procedure, this technique involves the creation of 2 full-thickness wounds extending through the panniculus carnosus on the mouse dorsum. Then, silicone splints are centered and fixed to the skin with immediate bonding adhesive and nylon sutures. We demonstrate that when applied to normal wild-type mice, the course of wound healing replicates the mechanisms underlying human wound healing. Not only this, but we also examined this technique in diabetic mice, an established model of type 2 diabetes mellitus, and found that the course of wound closure closely replicated the clinical observations in human diabetic patients. Overall, splinting wounds prevents wound contraction in diabetic and wild-type mice, allowing gradual wound closure to occur by reepithelialization and GT formation. Ending out the summer, some questions I hope to further investigate are, in adults who have adequate nutritional status and who have pressure ulcers, does providing further nutritional supplementation improve healing of those pressure ulcers? And, considering the differences and complications between mice wound healing and human wound healing, are mice models really efficient for investigating wound healing? Thank you!